welcome to our online parent education session. My name is Sarah Turner.
And I'm Gayani Rahim.
We're the Young People's Midwives for the Borough of Greenwich. Today we're going to look at postnatal care. We're going to start with the early days quiz, which we normally do in a group setting, but for today's session, Gayani is going to ask the question and I'm going to answer the question.
So question 1, what is the name of the baby's first poo? Is it A, MECONIUM, B, an enema, or C, Jaundice?
The answer is MECONIUM. So the first poo that a baby has is called MECONIUM. It looks like this. It's very, very thick and sticky, a bit like black tar. It's quite hard to get it off of the baby's bottom, so you have to use cotton wool and water and give it a good rub to try and get it off. Okay, so that's completely normal. This poo lasts for about 2 days and then it starts to change and go to more of a runny sort of browny green colour. Okay, and by day 5, your baby's poo is going to look a lot like this, which is like a bright yellow mustard or chicken korma. It's usually got little bits in it and it's all perfectly normal. It's a good sign that your baby's getting all of the milk that he needs. Okay?
I'm going to teach you how to change your baby's nappy in case you've never done it before. Before you get started, get everything ready. So you'll need some cotton wool, warm water, a barrier cream in case your baby's skin is sensitive, a bag to pop your dirty nappy and cotton wool in, and a fresh nappy. So ideally you'd want to change your baby on a changing mat, and actually on the floor is best, but if you're using a changing table, that's absolutely fine. Just make sure you never leave your baby unattended and really you keep eyes on your baby at all times. So as you start, or before you start, wash your hands, make sure they're nice and clean. It is just as important to clean your baby fully whether they have wet themselves or done a poo. If your baby's nappy is dirty, you can use the nappy to clean off most of the poo from their bottom. Then use cotton wool and plain warm water to remove the rest. Clean the whole nappy area gently but thoroughly and make sure you clean inside the folds of skin. Girls should be cleaned from front to back to avoid getting germs into their vagina. You might notice a discharge that looks a bit like egg white. This is perfectly normal and you don't need to clean it away. You may also notice your baby girl has some vaginal bleeding. This is normal and called a false period. It is caused by the mother's sudden drop of hormone called estrogen after birth. This blood-tinged discharge can last 3 to 4 days. Boys should be cleaned around the testicles and penis, but there's no need to pull back their foreskin. Take care not to get water or cream on the sticky tabs of the nappy, as they won't stick if you do. If your baby's cord has not fallen off yet, it is a good idea to fold your baby's nappy down so that the cord is not trapped underneath. This helps avoid getting wee or poo to the area and reduces risk of infection. Chat to your baby while you're changing them. Pulling faces, smiling and laughing with your baby will help you bond and help their development. Try not to show any disgust at what's in their nappy. You don't want your baby to learn that doing a poo is something unpleasant or negative. So that was a quick tutorial teaching you how to change your baby's nappy. Remember, once you finish, pop your dirty nappy and anything you've used in a nappy bag, and then you can just get rid of it in a general waste bin. So when a baby has jaundice, what colour is their skin? Is it A, pink, B, yellow, or C, red?
The answer is yellow. When there is too much bilirubin in the baby's blood, it gives a yellow colour to the skin. The liver will break it down, but sometimes it takes a little bit longer to do this. To help your baby's jaundice, you can place your baby in the daylight. Also, feed your baby every 3 hours. Always contact your midwife to discuss if you feel your baby looks yellow.
Question 3. Babies feed roughly A, once a day, B, responsively when they're hungry, or C, 3 to 6 hourly.
The answer is responsively when they are hungry. There are some cues that your baby will give which show that baby is ready to be fed. It is better not to wait until baby is crying before offering a feed. Babies wake up, they may look around, they may have their hands in their mouth, they may root, which means they're opening their mouth looking to the side, looking for the breast or the bottle. And usually it's easier to get baby to feed if they're nice and calm, so before they get to their cross stage of crying.
Question 4. Your breast will fill up on which day? Is it A, 1, B, 3, or C, 5?
The answer is day 3. Your breasts fill up on day 3. The day that your baby is born, the baby's tummy is the size of a marble. So the capacity of your baby's tummy is about 5 mils. It's very small, which is why your body only produces a very small amount of colostrum. It's exactly the right amount that your baby needs at this stage. By day 3, your baby's tummy is the size of a ping pong ball. That's the same day that your milk comes in and the volume of milk in your breasts increases to match the baby's needs. By day 10, your baby's tummy is the size of an egg. It is quite common when your milk comes in for your breasts to feel very heavy and engorged. It is a good idea to use warm water and flannels to massage your breasts and feed your baby frequently at the breast to help relieve the engorgement.
Question 5. The first milk a baby has is called A, colostrum, B, hind milk, or C, fore milk.
The answer is colostrum. Colostrum is thick, golden in colour and sticky. It is full of antibodies and is highly calorific. Colostrum is easy to digest. It is a small volume to match the size of a newborn's tummy.
Question 6. How should I care for the umbilical cord? A, clean it with soap and water. B, leave it alone. It might hurt the baby. C, fold the nappy down, clean it with cold boiled water and cotton wool if it becomes sticky.
The answer is fold the nappy down, use cool boiled water and cotton wool and give it a clean if it becomes sticky. The umbilical cord may be sticky and smelly as it separates. If the base around the cord is red or inflamed, you must contact your midwife. The umbilicus heals from the inside out, so it will take some time for it to look like a normal belly button.
Question 7. If baby seems cold, Which body parts do you feel to check their temperature? Is it A, their head, B, their tummy, or C, their hands and feet?
The answer is you feel their tummy. So place a hand on baby's torso or tummy to feel how warm the baby is. If the baby feels warm, he is warm, and that's fine. It's normal for baby to have really cold blue hands and feet, and that's because their circulation is concentrating on going to their major organs and their peripheries get a little bit forgotten. It's fine and it's normal. Okay? The general rule of thumb is that baby needs one extra layer than you're comfortable in. So if you are comfortable wearing just a t-shirt, baby should have a vest and a baby grow as well. So one more layer than you are comfortable in.
Question 8. What is the best way to clean sticky eyes? Is it A, cold boiled water and cotton wool, wiping from the inside out and discarding off the cotton wool? B, leave them alone, they will clean themselves. C, drop breast milk into the eyes and wipe with cotton wool.
The answer is to use cool boiled water and cotton wool, wiping from the inside out and discarding the cotton wool. It is normal for baby to have sticky eyes. The tear ducts are not fully formed when they're newborn. To clean the baby's eye, you need some cool boiled water and cotton wool, and you gently cleanse from the inside out, discarding the cotton wool and using a clean piece to do it again. If your baby's eyes are persistently sticky, let your midwife know as we can take a swab.
Question 9. If baby is constipated, what can you do to help? A, give fresh orange juice. B, give a laxative. Or C, give 1 ounce of cold boiled water.
The answer is to give 1 ounce of cool boiled water. It is quite normal for babies to get a bit constipated. To help your baby, you can give some tummy massage quite firmly in a clockwise direction, round and round like so. This will give some relief to the baby and may help the bowels to move. You can also try to bicycle the baby's legs, which means going up. It's difficult to show it on a dolly, but you're going in like this sort of motion with the baby's legs.
Question 10. Which remedy can you use from birth to help with wind? Is it A, gripe water, B, Dentinox, or C, Infocol?
The best thing to use from birth is Infocol. It's quite common for babies to be windy when they're newborn. You might find your baby's windy if they are wriggling a lot, they have fluttery eyelids, and often windy babies pull their knees up to their tummy in discomfort. To help your baby, you need to wind your baby effectively. So sit your baby with their back completely straight and support them under the chin like this. You can rub your baby's back firmly or tap the baby's back. Some people prefer to have baby over their shoulder, so holding the baby close and tapping the baby's back. Be careful they're not sick down your back.
Question 11. How often should you bath your baby? A. Daily. B. Once a week. C. 3 times a week.
The answer is once a week.
You can bath your baby anytime once they're over 24 hours old. You want to pick a time when baby's awake and content and not just had a feed, he's hungry or tired. Be mindful, babies lose heat quite quickly, they can get cold, so bath time should be quick. For this reason, you want to make it a 2-step process, and you want to bath your baby's face and head first and then their body. In preparation for your bath, make sure the room is warm, have everything ready. So you need fresh clothes, a clean nappy, some cotton wool, a towel, a changing mat, and then you need your bath or a large enough bowl. So with your baby bath, you want to make sure the water is warm but not too hot where you could burn your baby, and you don't want it too cool where your baby won't enjoy the bath. To check the temperature, use your elbow and always mix the water so there's no hot patches. Hold your baby on your knee or lie them on a changing mat. Take off all their clothes apart from their nappy and wrap them in a towel. Dip the cotton wool in the water, making sure it doesn't get too wet, and wipe gently around your baby's eyes from the nose outward, using a fresh piece of cotton wool for each eye. This is so that you don't transfer any stickiness or infection from one eye to another. Use a fresh piece of cotton wool to clean around your baby's ears, but not inside them. Never use cotton buds to clean inside your baby's ears. Wash the rest of your baby's face and neck. Next, supporting their head over the bath, wash their hair with plain water. Once you've dried their hair gently, you can take off their nappy, wiping away any mess. Lower your baby gently into the bath using one hand to hold their upper arm and support their head and shoulders. Again, don't add any liquid cleansers to the bath water. Plain water is best for your baby's skin in the first month. Keep your baby's head clear of the water. Use the other hand to gently swish the water over your baby without splashing. If your baby's cord has not fallen off yet, avoid getting it wet. If you do happen to get it wet, be sure to pat around the area until it is dry. Remember, never leave your baby alone in the bath, not even for a second. Lift your baby out and pat them dry, paying special attention to their creases in the skin. This is a good time to massage your baby. Massage can help them relax and sleep. Some babies cry throughout bath time. It will help your baby to relax if you keep talking while you wash them. The more they hear your voice, the more they'll get used to listening to you and start to understand what you're saying. This is very good for their brain development. Remember, you don't need to bath your baby every day. If your baby finds bath time stressful to begin with, you may prefer to just wash their face, neck, hands and bottom carefully instead whilst they get used to it. This is also known as topping and tailing. Question 12. The neonatal blood spot test is performed on which day? A, day 5, B, day 10, or C, day 15?
The answer is day 5.
On day 5, we will test your baby for inherited conditions. We do this by pricking their heel with one of these devices, and we take 4 drops of blood to put on this card. Okay. The inherited conditions that we test for include sickle cell, cystic fibrosis, an underactive thyroid, and other dietary conditions. None of these conditions are curable, but they are treatable. The results can take up to 2 weeks, two weeks or more to come back, and you will get a letter in the post if the results are fine. If there are any problems with the results, someone will call you to discuss treatment or further testing. Newborn babies lose weight in their first week of life. Is that true or false?
The answer is true. We will weigh baby on day 5. It is normal for baby to have lost up to 8% of its birth weight. We will re-weigh the baby around day 10 to 14 to make sure baby's regained its birth weight.
Question 14. When registering your baby's birth, you must do this by A, 1 week, B, 6 weeks, or C, 1 year.
The answer is B, 6 weeks. When you are discharged from hospital, you will be given a pack like this. It is a good idea to phone the registry office as soon as you can to make an appointment, as there can be a long wait. On the back page of these notes, you will find the registry office phone number.
Question 15. Which sleeping position is best for your baby? A, place the baby on their tummy. B, place the baby on their back with their feet touching the end of the cot and no pillows or bumpers to be inside the cot. Or C, place baby on their side.
The answer is to place baby on their back with their feet to the bottom of the cot with no pillows, bumpers or teddies inside the cot. It is important not to overheat your baby. Do not put a hat on your baby when indoors, and do not use too many blankets. 1 is sufficient. There should be no smoking indoors. People who smoke in your household should go outside with an overcoat on, remove it when they come back and wash their hands. It is important the baby has their feet to the bottom of the cot with no pillows, duvets, bumpers or teddies around, as this would cause a suffocation risk.
Question 16. How soon can you fall pregnant after having your baby? A, straight away. B, within 4 weeks. Or C, you are safe if you are still breastfeeding.
The answer is straight away. You can fall pregnant straight away. We will discuss contraception with you at your discharge visit. We will forward your details to the contraceptive nurses in Greenwich who can contact you to arrange an appointment. So it's important to use condoms until you have a more long-acting contraceptive in place.
Question 17. It is normal for you to feel tearful after having your baby. True or false?
It's true. Your hormones may dip around day 3 to day 5. This may cause you to be tearful. Sometimes the tearfulness or the anxiousness may last longer. Please speak to your midwife. Young Mums Aid are a fantastic support to many young mums. Please speak to your midwife about this. You can be referred.